Hello everyone, my name is Kendyl Terry, and for this group presentation my partner was Micah Barnes. So for this presentation our group disorder was musculoskeletal disorders. Here we focus on two specific diagnoses, osteoporosis and arthritis, and in these we go over causes, symptoms, risk factors, as well as cultural and social implications and functional limitations. And then for the rest of the slide, outside of those, we talk about legal and ethical issues, takeaways, we answer some discussion questions, as well as psychosocial impacts, common referrals, and common treatments. So I hope you guys enjoy. So for the rest of this recording, I will be hiding my face just so it's easier to see the notes on the slides. I also want to point out that while I'm recording this solely, this was a joint effort between Micah and I, and here we go. So musculoskeletal disorders involve injuries or chronic conditions affecting the bones, muscles, tendons, joints, ligaments, and connective tissues. And some examples of this include arthritis and osteoporosis, which are the two diagnoses that we specifically dive into in this project. This also includes chronic back pain, tendinitis, carpal tunnel, and many more. We go into causes further on in the slides, but some common ones are repetitive motion, poor posture, trauma, overuse, and or chronic strain. Musculoskeletal disorders are also among the leading causes of disabilities worldwide, especially mobility disabilities. And there is an increased association with mental health issues, specifically depression and anxiety, which is something we also talk about as we get into the presentation. As of 2022, more than 1.7 billion people were affected globally, and as of 2023, these were the leading causes of workplace absences and decreases in productivity. So over the next few slides, I will be discussing the symptoms, causes, implications, and functional limitations of the musculoskeletal disorder osteoporosis. So osteoporosis is a bone disease that normally occurs when the body either produces too little bone, loses too much bone, or both. So just to break down the word a little, osteoporosis starts with osteo, meaning bone, and then porosis, meaning porous, spongy, or fragile. Basically what happens is normally healthy bones resemble honeycombs, as you can see in the picture that I put on the slide. However, with osteoporosis, holes and spaces in the honeycomb will enlarge, as you can tell on the right side of the picture. So with these enlarged holes and gaps in the bone area, the bones thin and make them a lot weaker, which makes them prone to fracturing, breaking, etc. In this picture, you can also see the healthy spine of someone without osteoporosis, and then an osteoporosis-ridden spine, and you can see the large holes in between the bones that make up the spinal cord. About 54 million Americans have osteoporosis, and it is responsible for roughly 2 million broken bones and $19 billion in associated costs per year. It is also often referred to as a silent disease due to not being able to feel your bones weakening or breaking. And some of the first warning signs for osteoporosis include fracturing or breaking a bone, getting shorter, and or upper back curving. So to get into the causes, we'll first start with risk factors. So this includes sex, age, family history, and hormone levels. So for sex, some research actually finds that women are more likely to develop osteoporosis. And as for age, this is a little more self-explanatory. The older you get, the greater the risk you get of getting osteoporosis, because as you get older and your body ages, your bones just naturally get weaker. And as for family history, genetics can play a part in osteoporosis, as having immediate family members with this disorder can put you at greater risk, similar to other disorders as well. And lastly, your hormones. So this goes hand in hand with why women tend to be more likely to develop osteoporosis, as reduction in estrogen And also testosterone levels can speed up bone loss or increase bone lack of density. There are a couple medicinal factors as well. So prolonged uses of corticosteroids like prednisone, cortisone, and others can interfere with the bone building and bone modeling process. So it is important that if you are taking these corticosteroids, just to check in with your doctor to make sure that it hasn't contributed to any osteoporosis developments. And as for medical conditions, diseases like cancer, rheumatoid arthritis, which is another musculoskeletal disorder, celiac disease, and kidney/liver disease can lead to increased risk of osteoporosis as well. It is important to note that you do not need all of these. Sometimes you only need some, sometimes you only need one of these causes to develop osteoporosis, which is why it's important to constantly check in with your doctor. And besides the causes listed on this slide, there are also certain lifestyle habits that can increase the risk, such as long-term inactivity, as well as prolonged alcohol and tobacco use. And I've added a picture on this slide, just a chart, that includes other causes besides that, one of those being oxidation. So this is when the body produces too many damaging free radicals, which can disrupt bone modeling, and this can lead to decreased bone density and an increase in bone fractures. So some more causes include the dietary factors, one of these being low calcium levels in the body. So calcium is an essential mineral for bone health, and an intake in foods rich in calcium can help with prevention. And on this slide, I've provided a chart that gives a breakdown of foods rich in vitamins and minerals that can help with bone health. So a lot of these include fish, such as sardines and salmon that can provide calcium, and as well as vitamin D. There's also a plethora of fruits and vegetables like collard greens, spinach, tomatoes, red peppers, prunes, and these can provide potassium, which also helps with bone density, vitamin C and K, and calcium. And there's also fortified foods like soy, rice milks, and cereals that can provide the body with calcium as well. So ingesting any of these foods is really good, not just with decreasing the risk of osteoporosis, but just with overall health as well. Some other dietary factors include eating disorders. Being underweight and or disordered and restricted food intake can weaken the bones, which can lead to bone fractures and bone breaking, as well as gastrointestinal surgery. This surgery that normally happens after weight loss can limit the surface area that can absorb nutrients like calcium, which we talked about is really good for bone health. So now we can get into a few symptoms of osteoporosis. So as we talked about earlier, osteoporosis is known as a silent disease. So a lot of symptoms can go unnoticed and therefore untreated. And first symptoms actually tend to be broken bones after very minor incidents. For example, tripping or falling can lead to a broken ankle or a major fracture if you hit an object with your leg or your arm. Anything like that can be a telltale sign of osteoporosis or another bone disease. So some others include changes in posture, and you can see these in the two pictures I've added to the slides. So the first slide shows the person before osteoporosis, and as you can see, their vertebrae is standing upward vertically. And then after osteoporosis, there is an increased curvature of the vertebrae, leading to forward posture. Another symptom can include shortness of breath. This happens due to the disc in the spine becoming compressed because of the curvature in the vertebrae, which can lead to reduced lung capacity. And this can affect one's endurance in all facets of life, including their vocation or even in daily activities such as walking, can lead to someone being very out of breath. Osteoporosis can also lead to chronic back pain, especially lower back pain and the lumbar part of the spine. And a lot of times this happens because the lumbar part of the spine is holding up all the weight due to the curvature of the top part of the spine. And lastly, it is normal to lose up to an inch or even more off of your height due to the forward curving of the back. And in the bottom picture, you can see this happening with old age. The first woman is standing upright, and as time goes on, your spine continues to get more and more condensed, making you look shorter and ruining your posture. And this forward posture can also lead to pain in itself. A lot of pressure is put on the back of your neck as well as the lower part of your back, which decreases your functional ability, which we will get into later on in the slides. And now we are moving on to implications. So osteoporosis can affect one's psychological, social, and physical environments and can have a profound effect on one's personal and vocational lives as well. To get into the psychological impact, one is it can increase fear and anxiety around falling. As you know, with osteoporosis, your bones can become very weak and brittle. So a lot of times people with osteoporosis will feel limited from doing regular or even strenuous activities, which increases their anxiety daily. It can also increase feelings of isolation and loss of independence. A lot of times your bones become so weak that you can't do any daily activities such as walking, dressing yourself, which is when you have to depend on caretakers or anyone you live with, and you lose a sense of autonomy as well as feelings of isolation. You may feel like you can't go out into the world, so you keep to yourself, which can greatly impact your social life, which can lead to feelings of depression, loneliness, etc. And lastly, it can cause negative thoughts surrounding your body image. With osteoporosis, as your muscles weaken, they can atrophy, which can lead to disabilities and bone malformations, which can heavily change your appearance. And this can definitely cloud one's thoughts around their body image, which can deplete one's confidence. So as we've touched on with the psychological impact, this also goes hand in hand with social adjustment when you have osteoporosis. So these individuals may detach themselves from people they were once close to, family, friends, even romantic partnerships, and this can lead to a fear of intimacy as well. So going on to detachment, this type of self-isolation can make you feel embarrassed when going out in public. You may feel just negative thoughts about yourself and how you perceive yourself and perceive how you look. And as we talked about, that can lead to mood disorders like depression and anxiety. And fear of intimacy comes in especially because you start to lose some bodily function with osteoporosis, which can lead to you feeling like you can't have an intimate life. And the media does not help with that. A lot of times when we see people in the media with musculoskeletal disorders, they're not shown as being independent beings. They're not shown as having a lot of autonomy, and that can definitely pervade one's thoughts about their own independence when they develop these disorders like osteoporosis. Now we are going to move into the functional limitations of osteoporosis. So the first one that I have is mobility and strength, and there's a few ways in which osteoporosis really limits the way your body can move. One is fractures and other bone deformities can limit your joint flexibility, which negatively impacts one's range of motion. For example, just a simple bending of the knee or the elbow, moving your arm from your shoulder joint, anything like that can be heavily impacted when you have this disorder. This also comes with decreased muscle strength, and this can occur due to pain or even fear of fracture, which is something we talked about in the last slide when we talked about psychological implications. So this decreased muscle strength and decreased use of muscle strength, if you are fearful or anxious of this, can lead to an atrophy of the muscles and a weakness. And a lot of times this can lead to a physical appearance change. So a lot of times your muscles will appear a lot smaller, such as your legs or your arms. And also because of the decreased range of mobility in your bones and joints, jobs involving manual labor and or intense physical exertion may be a wrong fit for individuals with osteoporosis. And as future counselors, this is definitely something important to note, as some people may already be in vocations like this and get an osteoporosis diagnosis after, and we will have to guide our clients through making a career change. So another functional limitation is psychological, and that's something we briefly talked about. Anxiety and depression disorders can arise from acute and chronic stress that comes from this diagnosis, one of these being major depressive disorder, or MDD. And MDD is characterized by depressed mood, anhedonia, which is a loss of interest and enjoyment, and disordered sleeping habits. Besides MDD, anxiety is very common to occur, and it can manifest itself as excessive fear or worry, which can also exacerbate your already physical symptoms that you have, like heart rate and breathlessness. Another thing that you can get when you have osteoporosis that can impact you psychologically is ASD, which is acute stress disorder. And this is when individuals experience a mixture of anxiety, flashbacks, and distress related to a traumatic event. However, this can turn into PTSD if the symptoms last beyond 1 month. And some research has found that there is direct links to musculoskeletal disorders like osteoporosis, as well as arthritis and others, that can also lead into acute stress disorder just because of the distress that it puts on your body and your mind. So lastly, and this is a really pivotal one, in this diagnosis and in basically all musculoskeletal disorder diagnoses, daily activities and how you function when doing these daily activities can be heavily impacted. So individuals suffering from constant pain, fractures, and other symptoms of musculoskeletal disorders often run into trouble in their everyday lives as well. Some lose the ability to dress themselves due to atrophied muscles. They lose the ability to stand up by themselves and even walk on their own as well, often leading to having to use walkers or even wheelchairs. Research even shows that only about 40 to 79% of patients manage to regain their previous mobility function a year after a serious fracture, and less than half are able to return to pre-fracture ability in respect to daily activities. So this can, again, just heavily impact one's psychological outlook on life and on themselves, which is a big counseling consideration that we will get into later on in the presentation. The next disorder we will be discussing is arthritis. So for a quick overview, arthritis is a general term for conditions causing joint inflammation and pain. It usually leads to stiffness, swelling, and reduced range of motion, as well as chronic discomfort, and it will most likely lead to reduced mobility as well. Arthritis includes over 100 musculoskeletal disorders, and some common types include osteoarthritis or OA, rheumatoid arthritis, also seen as RA, psoriatic arthritis, juvenile idiopathic arthritis, and gout. And it is the leading cause of disability globally, and it can affect individuals across all lifespans. So there are several causes for arthritis, one of them being aging. So there is a higher prevalence of arthritis in older adults, and this is especially for osteoarthritis. Another cause/risk factor is genetics. Similarly to osteoporosis, your family history increases susceptibility. So if you have someone in your immediate family that suffers from arthritis, then it increases your chances that you might be diagnosed as well. Also, similarly to osteoporosis and other musculoskeletal disorders in general, women have higher rates of diagnosis in most forms except for gout, which is something that research has found. Now, injury or infection to the joints can also cause arthritis, as prior injuries accelerate cartilage degeneration, which increase inflammation and swelling. The more your joints rub up together, the more friction, which is bad for the body. And lastly, but autoimmune dysfunction can also lead to this diagnosis, and obesity and poor posture can increase joint stress, which can cause it as well. We've basically gone over the symptoms, and they're pretty, you'll notice that musculoskeletal disorder symptoms and causes kind of are consistent across the board. So similarly to osteoporosis, symptoms of arthritis are difficulty performing routine tasks, but a lot of the pain is focused on the joints instead of the bones and muscles. So you'll get joint pain, stiffness, tenderness, and or swelling. You also run into fatigue and loss of flexibility, as well as warmth or redness around the affected joints as well. Different to osteoporosis, which is known as a silent disease, and you can't really see it happening in arthritis, there are normally physical signs. Now, to get into implications of arthritis, for one, we have physical implications. This can include reduced mobility and strength, increased risk of falls and other injuries, as well as chronic fatigue, chronic pain, swelling, stiffness, and reduced strength, like we said. There's also psychological implications. A lot of times, as we discussed about musculoskeletal disorders in general, arthritis can lead to depression and anxiety from constant pain. This leads to decreased quality of life and independence, which can also cause a lot of individuals to socially isolate, which leads us into social implications. These individuals can have difficulty maintaining employment due to the physical limitations, and as well as limited social roles due to dependence on caregivers and or family for support. If we want to get into some more technical terms for the functional implications, there's limitations in activities of daily living, also known as ADLs, and instrumental activities of daily living, also known as IADLs. And so this can be anything from eating, standing, walking, dressing yourself, bathing yourself, anything that we don't normally think about on a daily basis until we encounter a musculoskeletal diagnosis that impedes our function. Lastly, this also comes with the medical complications. You can encounter increased cardiovascular risk, physical deformities, and reduced bone density. So arthritis comes with a variety of functional limitations, and one of these is mobility challenges. So this can include difficulty walking, climbing the stairs, or even standing for long periods of time. This also comes with fine motor difficulties that can include problems with writing, problems with gripping. So you can't grip pencils, you can't grip doorknobs, you can't grip lids if you want to open anything. Buttoning your clothes or even opening containers can be very hard, which contribute to the ADLs that we previously spoke about. This also includes fatigue. So chronic inflammation and pain can interfere with endurance and physical activity. So you can often find yourself tired simply just walking up a flight of steps with this condition. And this also leads into reduced range of motion. So stiffness of the joints limits your daily activities such as dressing, reaching, bending your arm, your legs, or anything else having to do with your joints. And so all of these functional limitations can make it very hard on the individual because it makes daily tasks 10 times harder, which can not only affect the physical body, but the mind as well, which is why it's really important as counselors that we take these functional limitations into consideration. These are comprehensive disorders, meaning they require comprehensive care because they take over all facets of oneself. Now, really quick, before I move into cultural and social factors of musculoskeletal disorders, I do want to kind of speak on the psychological impact and social adjustment that goes into the arthritis diagnosis. So there's several emotional effects like anxiety and depression, as well as frustration and grief, all related to chronic pain and the limitations that one faces. And that can lead into social participation. So limited mobility may reduce engagement in social, recreational, and or family activities. Basically what happens is when you feel overly dependent on other people, as well as your body may be changing in ways that you don't like, and you're feeling like a different person, you often encounter feelings of embarrassment, feelings of loneliness, feelings of despair that cause you to retreat inward and not want to participate with any outward functions. And it's important to talk about employment and identity because strain on work roles may impact self-concept and financial stability. Musculoskeletal diagnoses like arthritis oftentimes are diagnosed when people are well into their lives. They may have a career that's very physically strenuous, and so it's important as a counselor to know that in this diagnosis, they could lose their career. They essentially lose their financial stability, which comes with a whole other set of problems that can only exacerbate physical symptoms. So it's very important that as rehabilitation counselors, we are constantly aware of that fact. And to help that, we can implement a lot of coping strategies besides counseling, such as support groups. Support groups can bring about a sense of community back to these clients that normally have felt alone. By talking to people that are going through similar things that you're going through with similar musculoskeletal diagnoses, you essentially can curate a family, which can increase client participation and client motivation. And so now we can touch on cultural and social factors of people with musculoskeletal disorders. So starting with cultural beliefs, these influence perceptions of disability and willingness to seek help. Some cultures may view chronic pain as a normal part of aging and or physical labor. And in a lot of cultures, enduring pain is viewed as a strength. Sometimes you are socialized as a kid to just suck it up, pull yourself up by your bootstraps. And so as children, we can take these ideologies into adulthood. And so when we do encounter bouts of pain, we don't take it as seriously as we should. There's also a lot of social factors that go into the musculoskeletal diagnosis. One being how we've already touched on, reduced work mobility and functional ability can lead to depression and isolation. There's also a lot of social events that people with this disorder get upset about because they might not be able to participate, which furthers social isolation. Besides that, there's stigma. Some communities may minimize or stigmatize chronic illnesses like arthritis or even more silent diseases like osteoporosis, ones that you can't see because they're not taken as seriously as others that are more physically manifested. There's also institutional factors that go into these diagnoses, like healthcare access. Because these disorders do not discriminate, people of varying income status can encounter these diagnoses. Some may not have insurance, which can impede specialty care outcomes and other healthcare access, because in this country, health insurance is not universal. So it is important as a counselor that we take that into consideration when we are talking to our clients. Our clients want to be in a safe space, they want to be seen, and they want to be heard. So it is important that in our safe space, we are very cognizant of the cultural barriers that are present when we are speaking to different types of people. And lastly, as a counselor, you want to lean on community and family supports. Cultural norms shape caregiving roles, and so it is important that we know that, and you can even gather that information from talking to your client. Seeing the way into their family, how they were socialized growing up can give you these answers, and referring them to communities that can be supportive of them, like we mentioned earlier, some support groups. Now we will be getting into some common treatments for individuals diagnosed with musculoskeletal disorders. There's a few ways you could go about this. So some treatment recommendations are normally based on the individual's FRAC score, and that's Fracture Risk Assessment Tool score. So the FRAC score is an estimate of the individual's risk of breaking a bone in the next 10 years, and a lot of physicians will use that. Now, individuals with a high risk of broken bones are normally prescribed medications known as bisphosphonates. So alginates such as Benosto or Fosamax, zoledronic acids like Reclast and Zometa, risedronates such as Actonel and Atelvia, as well as ibandronates are some classifications of medications that are prescribed. Now, as future counselors, we don't need to know that, but it is important to just have a basis in case your client ever brings it up in session. Vitamin and mineral supplements can also be used as short-term relievers. And so over-the-counter or prescription calcium and vitamin D supplements can help with any pain that the individual might be experiencing. And it also can help strengthen the bone. As we talked about earlier, calcium is really good for bone strength and muscle strength. Next, we'll go into physical therapy. And there's a lot of types of physical therapy that are common treatments for these disorders. So physical therapy can be a very useful tool for strengthening the injured area and improving mobility. And so this can include exercising, stretching, massages, hydrotherapy, and transcutaneous electrical nerve stimulation, or TENS. So we can go a little bit into hydrotherapy, which is kind of like an alternative physical therapy remedy. And basically this uses water to help with muscle relaxation and pain relief. As far as TENS, that's another alternative therapy. And what happens is the physician will use low electrical currents to block or change the individual's perception of pain near their nerves. These two are not super common, but as time goes on, they're getting integrated more and more into people's treatment plans. So now we'll go into common referrals for musculoskeletal disorders. And there's a few. That's why interdisciplinary teams for these disorders tend to compromise a lot of different vocations. So we'll start off with surgeons. I have a specific example of orthopedic surgeons on this slide. They treat diseases affecting the bones, muscles, joints, tendons, and ligaments. Surgeons normally are used for the most severe and advanced injuries/disorders. In musculoskeletal ones, these will be advanced joint deterioration, as well as severe and persistent pain that's not relieved by medication. This can also include neurological deficits like nerve compression, which can negatively impact breathing ability, as we talked about earlier, due to compression of discs in the spinal cord. We'll move on to rheumatologists. So they diagnose and treat conditions that affect the joints, muscles, and connective tissues. Conditions that affect other organs like the lungs or heart, inflammatory joint or connective tissues that can be seen in lupus, fibromyalgia, and rheumatoid arthritis. Those will all be addressed by rheumatologists. Next, we have pain management specialists. These are people with crippling pain that aren't responding to other treatments. So pain management specialists will come on and work as part of the multidisciplinary team to diagnose the source of the chronic pain and focus on ways of improving quality of life in the individual. Then we have physical therapists, which we've talked about. They will help with joint function and learning how to navigate life with limited function after diagnosis. A lot of times they help with simply improving function for daily tasks such as walking, standing, dressing yourself, bathing yourself, eating, things like that. And lastly, psychologists, counselors, social workers. So they will focus on the psychosocial aspects of the chronic pain and other symptoms associated with the disorder. Now, counselors especially, are used to bridge the gap between the medical and psychological side of care. And so they just add to the comprehensive care that these clients will get. Now we are going to move into clinical considerations for individuals with musculoskeletal disorders. So one of the things to consider is reviewing the client's treatment history. It is important to screen for previous medication use. As counselors, we must know if the client has been prescribed any medications for previous psychosocial interventions like depression or anxiety, or as well as any other pharmacological medications like for pain relief. Now, counseling strategies are very important, and there are a few. One of these is motivational interviewing. So this will help affirm the client as they adjust to their life, Positive affirmations, empathy, and encouragement are vital in the improvement of the quality of life for the client. You can also do this through goal setting. So goal setting will help the client set realistic and functional goals that can increase their motivation and promote empowerment. You can use the SMART framework, which is specific, measurable, achievable, relevant, and time-bound. And this will give the client a structure to follow, which allows the client and counselor to work in collaboration to adapt routines and integrate self-management goals like stretching, ergonomic interventions, etc. Another important thing is to coordinate with providers. It is important to work with a multidisciplinary team to provide comprehensive care. Musculoskeletal disorders do not just impact one physically, but also emotionally, mentally, socially, psychologically. And so it's important that the care that we give our clients is holistic, and that does mean coordinating with other people like physical therapists, surgeons, primary care physicians, and etc. Now, the counselor's role is very important, and we take on a few roles. One of these is to reinforce successes as well as validate setbacks. So reinforcing successes, you can do this as we talked about in motivational interviewing. This is just about creating a safe space for the client, empathizing with them, encouraging even the little wins, such as being able to dress themselves or take a step if they have been mobily impaired for a while. That's really important. On the other side of the coin, it is also very important to validate setbacks because progress is not linear. And so it's important that our clients know that setbacks aren't necessarily failures, but rather just learning opportunities and just pathways for growth. And so that goes hand in hand also with celebrating the small and large achievements. It's important that the client knows that any progress is great progress. So counselors can also help clients modify and recognize emotional responses to chronic pain, and they can do this through relaxation training, such as breathing. There's deep breathing techniques like the 4 method, where you inhale for 4 counts, release for 4 counts. These are short-term methods of pain relief just to help for in the moment when maybe distress or anxiety gets too high. And they can also do this with cognitive restructuring. That's part of a cognitive behavioral therapy technique where it kind of reframes the client's mindset and restructures any negative thoughts that are impeding their progress. Now, one of the biggest responsibilities of a counselor is to be an advocate for their client. Being an advocate can even just mean advocating for ergonomic interventions in their workplace, such as adjustable equipment, maybe in chairs or adjustable tables, as well as advocating for intermittent breaks for your client. And musculoskeletal disorders, a lot of times they can reinforce bad posture, and it can be a big burden on the body physically. So even being able to just talk to your client's employer about giving them a little bit more breaks and time just to relieve any distressing worries on their body can really help vocational success as well as psychological success. This slide touches on legal and ethical issues. As a future counselor, we will encounter these no matter what type of diagnosis the client has or if the client has even no diagnosis at all. And so it's important that we just know these in general, and here's just a basic overview. One is confidentiality and documentation. It is very important as counselors that we maintain accurate medical records, not just for our client, but for ourselves, as it will only improve treatment. And adhering to HIPAA laws and confidentiality is incredibly important. People come to us to be safe spaces for them, and to provide those safe spaces, we must ensure that anything they say with us stays with us, to help with client-counselor collaboration. The next thing is informed consent. You want to ensure that your clients understand treatment plans and risks of medication. In musculoskeletal diagnoses, medication is a vital part of treatment, as well as surgery may be a vital part in other physical therapies. We talked about some alternative therapies like hydrotherapy and TENS, and that can require a lot of technical language. As the counselor, one of our roles is to break that down for our clients and ensure that they know what they're getting into. And it is important as future rehabilitation counselors that we do not insert our opinion. We may not always agree with the treatment plans that they wish to adhere to, but it is not our job to insert our advice. It is our job to help guide them with whatever they feel comfortable doing. So we must always be cognizant of that fact as well. And lastly, on this slide, we have disability rights. It is important as future counselors that we are familiar with the ADA, which is the Americans with Disabilities Act, and the accommodations for work and education. When you encounter musculoskeletal diagnoses, a lot of times this can negatively impede your mobility, and it can really change the way you move throughout life, metaphorically and physically. So it's important that we are up to date with accommodations, and we know how the ADA will impact positively our clients. And we can also be used as psychoeducational tools. A lot of times clients will come into our offices not really knowing what's available to them or what they are owed or what is their right, because it's not commonly talked about in media. So it is important that we give them these resources and the psychoeducation they need to make informed decisions and to improve their quality of life in other areas outside of our care. On this slide, we have provided key takeaways that you will get from this presentation, just to sum up all the information. I'm going to start with musculoskeletal disorders affect all facets of the individual, including social, physical, vocational, and psychological. Because it is such a multifaceted disorder, it requires comprehensive care, usually in multidisciplinary teams, as we talked about. Counselors should be well informed of causes, symptoms, functional limitations, implications, and counseling strategies that go into musculoskeletal disorder care. And that's honestly consistent across all types of disorders. As counselors, we need to be advocates, we need to be guides, we need to be emotional and social supports as well. So it's important that we are multifaceted in all of these different areas. Another takeaway is multidisciplinary teams include varying occupations: counselors, rheumatologists, physical therapists, social workers, etc. You don't have to know everything that goes into these different vocations, but as rehabilitation counselors, you will find yourself working in interdisciplinary teams. So it's important that we know how to work with different types of jobs, how we can be advocates for them in those types of jobs as well, and how we can receive feedback and engage in collaborative care for the increased quality of our clients. And the last takeaway is that it is important that counselors are aware of the legal and ethical issues involved, such as informed consent, confidentiality, and ADA accommodations. Like we talked about, this is one of the most basic and foundational aspects of counseling. Adhering to HIPAA and making sure that your client has the educational supports that they need to help with their new type of lifestyle is vital in ensuring increased quality of life. Besides these takeaways, I hope that you guys learned some more about the specific disorders like osteoporosis and arthritis. There's so many other disorders that go into musculoskeletal diagnoses, and as we've talked about, it's one of the leading causes of mobility impairments. So it's important as counselors that we are well educated and have a lot of knowledge on these, so we can best equip the people that come into our care. And yeah, those are our key takeaways, and in the next slide there will be discussion questions. So we wanted to end this presentation off with a discussion, and so we've provided 5 discussion questions that will kind of help you just jog your memory and help you kind of implement the practices that we've put on this presentation into real life. So first question is, we give you a scenario of Theo, and it's, can you come up with your own SMART plan based on this client? Then we ask why arthritis is considered a medical and social issue, and what risk factors do you think contribute most to arthritis? We touch on how lifestyle factors can contribute to arthritis development, and what type of treatments would you suggest to a client who is not responding well to pain medications and is experiencing intense and chronic pain from their fibromyalgia. So on our next few slides, we have the references that we use for this presentation. And thank you for listening to me and Micah's presentation on musculoskeletal disorders. If you have any questions, please feel free to let us know. Thank you.